This your Houston chiropractor, Dr. Gregory Johnson, and we have Willie here with us this morning. And Willie has come here after watching our YouTube videos on lower back pain and leg pain, sciatica. You had to go to the emergency room, what, a few weeks ago?
Yeah, 3 weeks.
3 weeks ago, and he went into the emergency room and they told him he had sciatica and gave him a shot of Toradol and what else?
Some muscle relaxers.
And some muscle relaxers. Pain pills and muscle relaxers, kind of the normal medical way of treating these problems, but that didn't really help you, did it?
No, not at all.
So he's still having severe pain down his left SI joint here, and you can see his posture is translated and tilted off to the right already, but we're going to check that first. Let's have you close your eyes again, Willie, and bend your head forward and backwards, and then neutral. Okay, you can see, especially from the side view, his whole head is way forward and his head's kind of pointing down too. That's called a forward head posture, a forward translation of the cervical spine on the Z-axis. His ear's dropping way out here in front of his clavicle. It's supposed to be back here over his shoulders. That's why his shoulders are starting to round forward a little bit. You see that? And then looking in the mirror, he's got more room over here on this right side between his arm and his pelvis than he does over here on the left side. So his pelvis has translated to the left on the x-axis. We call that a positive SX pelvis. And he's also got less room here in the thoracic spine than he does over here on the right side too. Now I've already done his orthopedic neurological test, but there's a couple of highlights that I wanted to show you from that. Let's go ahead and lay on your back for me for a second, please, Willie. This is a very important test to do to see if the person is possibly a herniated disc or has lumbosacral radiculopathy. Pull the toe back, lift the leg straight up in the air. Is that hurting already?
Yes.
Is it where you feeling the pain at? See, he's feeling pain in his left SI joint, sciatic nerve area. The higher I go, the worse it gets. So he's at about 40 degrees here. Now, when I do this on him though, that doesn't cause him any increased pain, does it?
No.
Okay, but whenever I bring his leg over here and do the Fabry-Patrick orthopedic test on him, that hurts in your left SI back here, doesn't it?
Yes.
Not in your hip joint though, right? Okay. Now his strength's good on both sides. That was equal, and his reflexes were +2 equal and active as well. So we're going to get started adjusting him. So first thing I'm going to have you do, and Willie's lay on your stomach for me, please, sir. Now this is his very first time getting a chiropractic adjustment, right, Willie?
Yes, sir.
Now see, his right leg in this position is short by 1/2 inch. When I bring his legs up, that tightens up in your low back already, doesn't it?
Yes.
And legs get even. So that tells me his sacroiliac joints are misaligned in his pelvis, and that's really tender right there, isn't it?
Yes, sir.
So we're going to start off by adjusting his left SI joint first. So Willie, all you got to do is breathe and relax. You get the easy job. There we go. Now his sacrum is also deviated here on the left side. I did a sacral deviation test on him, and he couldn't even lift his left leg up at all compared to the right leg when I pushed down on the sacrum. So I'm adjusting his sacrum straight superior to inferior on the y-axis, and then I'm going to hit L5 straight P to A in the Z-axis. There's L4, L3, L2, and then we're going to hit the lower thoracics here. Just breathe normal. There you go. Okay, that's it. Okay. Now we're going to recheck his leg length here. His legs are exactly even now. I bet you this feels a little easier than the first one, Willie.
Yes.
Better?
Yes.
Okay, you're going to feel your head popping up a little bit on this next one. Good. Now we're sending him out for an MRI on his lumbar spine to see if he has any spinal canal stenosis. And I know he already has a herniated disc from the orthopedic test that I did on him, and that's how I'm treating him right now, as if he has a L5S1 disc herniation. There, okay, now, we'll just have you come over here on this table next. There we go. There. There we go. I'm gonna pin this pin in right here, slide up just a little bit more. This probably made you want to come in here, isn't it?
I can't see it, do you?
No, you can't say this, it did, huh? Okay, lay flat. There you go. It's going to be really tight. There it is. So what I'm doing is I'm locking his iliac crest in down here so I can traction his whole spine from his skull all the way down to the L5 vertebrae, which will take the pinching and pressure off the disc at L5S1 as well as the nerve. Okay. There we go. Okay, Willie, take a deep breath through your nose, but keep your teeth together. Let all your air out. There you go. Now you should have felt that all the way down to the bottom, did you?
Yes, sir.
Okay. Yeah, see, you're still kicking. You're good. Now, a lot of people think I'm just wrapping the towel around the neck and jerking. I'm not. This is a very, okay, relax this. There you go. Good. Very specific traction adjustment where I'm actually feeling the integrity of his spine, motion, and ligaments. Okay, just lay there for me. Relax your leg right here in my hand. There you go. Now you should have felt that in your knee all the way up to your back.
Yes, sir.
Okay. Same here. Just relax this one. Yep. Very good. Feel that one in your knee all the way up to your back as well?
Yes.
Good. Let's come over here and stand in front of the mirror for me now. Kind of get up sideways just like that. Yeah. Okay. We're going to face the mirror again. And I'm going to have you close your eyes and bend your head forward and backwards again. And then back to normal. That was a lot better range of motion. Take a look in the mirror. So your head's still a little bit forward. Willie used to play semi-pro football, so he's taken some beatings over the last several years. Hold that right there for just a moment. Just a little tap there. There. Okay, good. Now, relax. And this time when you go forward and backwards, I want you to tell us if that feels any better or smoother than the previous one.
Yes.
Back to neutral. See how his chin's up more now? Look at him from the side. His head's much further back. Look in the mirror right now, Willie. See how we evened out the space now?
Yes.
Shoulders are level, head's up and back where it's supposed to be. So that was your very first adjustment and treatment here at Advanced Chiropractic Relief. What would you say to our YouTube fans about your very first experience with chiropractic care?
I feel much better.
Feel better in your lower back? Not going and shooting down your leg as much?
Not as much, but I feel much better.
Great, great. Well, thank you for sharing your treatment experience with everyone.
Yes, sir. Thank you.
This is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.